Back on Night Talk, your lovable guest host, Mike Pinczek from KDK Radio here. I tell you what, I love having Melissa and Jim on the show, so we're going to, at some point, we're going to ask them back again to go head-to-head. But let's move on to this. If you have cataracts or you know somebody who does, you're going to want to pay close attention to this because there is a breakthrough therapy. It involves lasers to deal with cataracts, and this is something that you're going to want to know more about, and we're going to find out more about it. But first, let's get an overview in this report from Doris Scheidel.
This is the introduction of a new era in cataract surgery.
Dr. Matthew B. Mills is offering a new form of cataract surgery that uses a laser to make its incisions. Virginia Palmer came to get this surgery done.
Well, it's pretty exciting, especially if it works and other people will see and have it done, and so we'll see.
So this is the laser that actually makes the precise incision on the eye so that when Dr. Mills goes into surgery, all he has to do is use his instruments to remove the cataract.
Now, if you look straight ahead, can you see a red line inside the microscope? That's your target. You need to look right at that red light, okay?
This screen shows where Dr. Mills is making the incision on the eye using the laser. Once the preliminary incision is complete, Virginia goes into surgery. On this monitor, you can see Dr. Mills actually removing the cataract, something he's able to do a lot more accurately and easily thanks to the laser.
It can be more precise. It can help us more accurately place our incisions as well as deal with astigmatism that may be there. And ultimately, all of these steps add up to a more precise outcome in terms of visual correction.
Making the world clearer, one eye at a time.
Okay, so there's the report on it. Now, locally, one of the physicians doing this surgery is Lisa Sibick. Dr. Lisa Sibick is an ophthalmologist and a cataract surgeon. Lisa, welcome, doctor.
Thank you. I'm glad to be here.
On the line, we have on the phone line from the Eye Institute of Utah, LASIK and PRK surgeon and medical director Robert Cioni. Dr. Cioni.
Hello. Well, it's my pleasure to be here this evening.
Well, I wish you could actually be here, but on the phone is just great. If you don't mind, I'm going to start with Dr. Sibick. Dr. Sibick, we just watched that report there. Now, explain again what is new about this, first of all. I thought they were using lasers to do cataract surgeries in the past.
Well, everyone thinks that, but of course that's a fallacy.
Really?
We haven't really started using lasers to assist with cataract surgery, not until winter of last year, when Dr. Steve Slade, a surgeon from Texas, actually performed the first laser-assisted cataract refractive surgery in the United States.
Okay, so what are the benefits of this surgery over the old way of doing that?
Well, the benefits are that there's more precision and control and accuracy when you use a femtosecond laser to make corneal incisions, and also to perform part of the process that's very difficult to perform is the anterior capsulotomy. So these are crucial points in the cataract process. Also, this laser is able to soften and fragment the lens nucleus, and by doing so, it makes the intraoperative time less, and less time for also the surgeon to have to use ultrasound, which is called phacoemulsification, to remove the cataract.
Dr. Cioni, can you jump in here and add to that?
Yeah, what Lisa says is absolutely right.
Thanks, Bob.
The procedure of cataract surgery is a very safe procedure as it is, but we see a tremendous variability in results depending on the type of cataract that's there and the surgeon performing the surgery. By using this type of a laser, each and every surgery can be identical. So there's no variability in incisions, there's no variability in astigmatism correction, there's no variability in the results from one surgeon to the next. When we look at one step of the procedure, the capsulotomy, where we have to make a very precise round opening in the covering of the cataract so that we can remove it, we're seeing that if we try to get a certain size, let's say a 5 millimeter opening, we attain that 10% of the time when even skilled surgeons try that manually, whereas with the laser we attain that 100% of the time.
You know, as I was watching that report by Doris Scheidel there, at one point the patient is told, you see this red dot or whatever the heck they were talking about, the target, and you just keep looking at that. I had LASIK surgery years and years ago, and that brought back a memory to me, because at some point they have the laser over my eye, and they're saying, now you see the red dot, focus on that red dot. And I was scared to death that my eye was going to move and that the laser is going to cut the wrong thing. And so what's going on there? Tell me about that.
Well, actually, the femtosecond laser was used for the first time in ophthalmology, with being the flap maker in LASIK surgery. So, did they do your LASIK surgery using a microkeratome?
That's a knife. That's
yes.
a laser.
Yes.
A razor sharp instrument. Yes, that's what they did.
Okay.
They made a flap. They flipped off the outer part of the cornea, and then resculpted the underneath with the laser.
So about 10 years ago, with Intralase, the femtosecond laser was introduced into the United States as being the flap maker. So it used the femtosecond laser to actually create the flap. So part of this procedure is very similar to that, whereas we actually have to dock the patient interface on an individual's eye. And now we ask the patient to look at the flashing red light, and that is the patient interface that's coming down and being docked on the patient's eye.
What happens if you move your eye inadvertently? Then what?
Well, actually, what happens is you apply suction when the PI is docked on the patient's eye, so the patient's really not able to move the eye. And part of the skill in adapting to this surgery is to learn how to dock this particular laser in the instrumentation.
Okay. Dr. Siani, it's my understanding that this surgery, this cataract surgery, can also be used to deal with some other problems, like I forget the term of it, but as people age, it becomes harder and harder to see, small print and that sort of thing. And I forget the term for it. But can you rectify those problems with this?
Yeah, this is one of the tools that helps us become more precise in rectifying that problem. And what you're talking about is presbyopia. And what goes hand in hand with that many times is astigmatism. Astigmatism means the front of the eye is shaped a little more like a football than a basketball. And to get the best optical result, the best vision without glasses, you want to get rid of the astigmatism. The laser provides us the benefit of doing that very precisely, very accurately, very predictably in each and every case. Lisa made the analogy to the LASIK flap. You can think of this new laser like the LASIK flap maker on steroids, because not only does it hold your eye still to keep you from moving, not only does it make the precise incisions, but it also has a guidance system, so we can see what's happening. We can measure everything within microns of accuracy, which we couldn't do as predictably even with LASIK flap makers.
All right, we're going to take a time out here. I understand. I'm not sure what this means, but I understand there's some sort of controversy involving this procedure as well. So we're going to deal with that next when we continue on Night Talk. Back on Night Talk with a brand new way to deal with cataracts, a brand new laser surgery. It's called the LensX surgery, and just a handful of surgeons around the country actually do this. And here in Pittsburgh, Lisa Sibic, Dr. Lisa Sibic, who is an ophthalmologist and cataract surgeon, does this surgery. And in Utah, at the Eye Institute of Utah, we have him on the phone, LASIK and PRK surgeon Dr. Robert Sioni. I think you became the third to use this surgery as well. Dr. Sibic, there's some controversy about this. What is it?
Well, the laser the LensX system is rather expensive to acquire.
How expensive? Give me round numbers here.
In the range of $500,000.
Is that what you paid for it, Dr. Sioni?
Yeah, well, we're all paying for that laser. It's not a cheap thing, so you got to make certain you know how to use it, and we got to make certain that it works.
Okay, so what's the controversy? Is it simply because the laser's expensive? Or?
Well, I also think in the United States, cataract surgery is the most commonly performed surgery.
Really?
So, yes, absolutely. So it's difficult sometimes to adapt and adopt new technology. And when I first started performing cataract surgery 25 years ago, the state-of-the-art was extracapsular cataract surgery, in which you made a 7 or 8 millimeter incision in the eye. This progressed to a process called phacoemulsification, in which you use ultrasound to remove the intraocular, the nucleus, and replace it with an intraocular lens. And this reduced the size of the incision to 5 millimeters, and now it's even subsequently smaller. That was it's hard for surgeons to make that choice and to learn the technique. And I think there's some analogy to moving from phacoemulsification to adapting laser-assisted femtosecond surgery to phacoemulsification. Go ahead.
Well, okay, I was just informed we had a caller. We're not going to be able to take the call because I don't have the time for it, but she asked a good question. She wants to know, what is the cost to the patient for this?
And that's the other controversial issue, is that, yes, there is a cost to the patient because private insurances and Medicare and Medicaid do not cover for the LenSx part of the cataract surgery. So it's approximately, I would say around the country, about $1,000 per eye.
$1,000 per eye. Dr. Sioni, why do you suppose the insurance companies refuse to pay for this if this is such an effective surgery?
Well, number one, I think if you look at what's happening in the country today, the government already cannot pay for the Medicare services that are out there. So the real goal of this surgery is to provide precision, accuracy, which would decrease the chance that the patient's going to need glasses after surgery. That's the main drive for this laser. And the last thing that Medicare is going to want to do is say, hey, we're going to pay for you to throw away your glasses. I'm sure, Mike, that you paid for your LASIK out of your own pocket. Well, so they expect the patient to do that as well.
I see. Okay. Well, I wish we had more time for this, but unfortunately we're out of time. Dr. Sibik, I want to thank you for joining us today.
Thank you. It's been my pleasure.
And Dr. Robert Sioni on the line from the Eye Institute of Utah. And I'm Mike Pintek, your fill-in host tonight from KDK Radio. Hope you had a great evening. Thank you so much for watching us tonight. Have a great night. Bye-bye.